Good day, everybody. Good evening in some places, good morning in other places. Thank you for joining us. Welcome to today's webinar, Syria's conflict at 10 years, ongoing violations of international humanitarian law. I'm Susanna Sturkin, Director of Policy at Physicians for Human Rights, which is a non-governmental organization that uses the expertise and voices of medicine, public health, and forensic science to protect and promote human rights. It's truly an honor to moderate today's very important session, which is co-hosted by the Syria Public Health Network and the Johns Hopkins Center for Humanitarian Health. Today's event is part of a larger series hosted by the Syria Public Health Network on looking to the future, rebuilding Syria's fractured health system. Just by way of background, the Syria Public Health Network was established in early 2015 in response to calls from colleagues working in Syria and in the wider region for an independent and critical assessment of the humanitarian and health response to the conflict. It aims to create an independent space for discussion, analysis, and policy generation for effective health strategies and interventions in the context of the Syria crisis. And that's what we are here to do today. Our other co-host, the Johns Hopkins Center for Humanitarian Health, is a collaborative Johns Hopkins academic program conducted jointly by the Bloomberg School of Public Health, by the School of Medicine, and the School of Nursing. We could not be having this session today at a more critical and somber time for Syria and for Syrians. The 10-year conflict in Syria, which began after peaceful uprisings in March 2011, were violently suppressed, and the conflict has featured widespread and systematic violations of international humanitarian law, which we'll be describing as IHL just for brevity during the course of today's session, including among the violations more than 600 direct attacks on healthcare facilities, the torture and killing of hundreds of healthcare personnel, and the use of internationally prohibited weapons. Millions of Syrians have been displaced, are living in precarious conditions within the country, on its borders, or in a new and enormous Syria diaspora that includes a great many health workers who were forced to flee the country for their very lives. Obviously, these IHL violations have had a profound effect on Syria's healthcare workforce and its health system, leaving both of them devastated, even before the impacts of the COVID-19 pandemic. And in addition, mechanisms that were introduced to mitigate such attacks on healthcare, such as so-called deconfliction, have failed to prevent such attacks. And at the United Nations Security Council, there has been utter paralysis in efforts to support international accountability for the crimes in Syria due to repeated vetoes of resolutions by Russia and China. Now, next month, in a few weeks, there will be a critical vote at the UN Security Council to renew the mandate, which was established in 2014 for cross-border aid, humanitarian aid into Syria. Just yesterday, the US Ambassador to the United Nations, Ambassador Thomas Greenfield, said that for countless Syrians, this is a life or death vote at the UN, July 10th. I hope we'll be discussing that in today's session as well. The violations of IHL in Syria persist today, with a blatant and horrific attack on the Shifa hospital in North Aleppo rural province, just this past weekend. That attack resulted in 19 deaths, including 4 healthcare workers. To put the impact of that one attack to scale, the hospital provides an average of 10,000 services or consultations a month, including 350 deliveries and 250 surgeries, according to the Syrian American Medical Society, SAMS. And I wanted today also, as I introduce the session, offer our deep condolences to SAMS and the many others who were working, who had workers connected with their associations or them personally in that hospital. In today's webinar, we will explore the dire implications of the continuing normalized war crimes in Syria for the future of healthcare in conflict, not only in Syria, but also globally. We're very, very fortunate today to have 3 expert speakers who will bring their unique experiences and perspectives to the conversation. Some of them truly harrowing that they have experienced personally in Syria. I'll introduce each of them with an opening question, and then we'll move to a couple of rounds of questions and answers with them, followed by questions from all of you, I hope, which you can post in the chat following the first few rounds of my questions to our panelists. I just want to clarify a few ground rules. Please remember to keep your microphones on mute, all of you, and your videos off if you're a participant or an observer, unless you're a presenter. Your cameras are on, thank you. The session is being recorded and will be posted online. So if you do not wish your identity to appear in this recording, you are welcome to go up to the top right and change your name in the Zoom, and also, of course, keep your camera off. Also throughout the session, but hopefully starting after the first few rounds of questions, you can post your own questions in the chat, and there will be at least 15 minutes, maybe more, I hope, for question and answer and dialogue in following the interaction with our expert presenters. You can also post in the chat your questions in Arabic, and our colleagues who are from the Johns Hopkins Center and the Syrian Public Health Network will be translating them for me so that I can share them with everyone. So to start off, I'm very, very pleased and honored and proud to introduce my colleague at Physicians for Human Rights, Dr. Hossam Al-Nahas, who is the MENA researcher at PHR. He designs and conducts research on attacks on healthcare, detention, and access to health, and human rights, and monitoring human rights violations, including the COVID-19 implications of violence in both Syria and as well as the Yemen conflict. Dr. Al-Nahas is the recipient of the Joint Master of Public Health Syrian Scholarship and Summer Scholar Award from the Johns Hopkins Bloomberg School of Public Health. And he formerly served on the front lines of the healthcare response to the Syria crisis as a humanitarian response volunteer and an emergency room physician in a field hospital in eastern Aleppo. So I'm going to start with you, Hossam. I hope you don't mind if I refer to you in your first name. We're going to try to keep this informal, and ask you to tell us a bit of your personal story, what your journey has been throughout this conflict, and including, as you speak, the examples of the violations of IHL that you have witnessed and documented. So Hossam, thank you for joining, and over to you to share your story and your knowledge.
Thank you very much, Susanna, for this kind introduction. And yeah, I can start by saying I had the privilege and the opportunity to be part of the medical response and during the early phases of the Syrian uprising, and witnessing how this uprising shifted into an armed conflict, due to the brutal crackdown from the Syrian government on the protesters. So as a medical student back then, I was young, and it was shocking for me all the time to see these violations happening and these crimes happening. And each time whenever I witness these kind of violations, I say, there's no way something worse can happen. But unfortunately, what you talked about and your incredible introduction really gives an idea of about how the situation is right now in Syria. So I can start talking about the early phases of the uprising, when like the Syrian government, the security forces were attacking, shooting, killing protesters who were demonstrating, even when they were not part in the fighting or taking any part in the fighting, and then depriving these individuals from their right to access healthcare and arresting them or even kill them in healthcare facilities. For me as a medical student back then, with other physicians, it was like an obligation for us to support these people, and this is why we started establishing these like medical team that were like working on facilitating this access to safe healthcare and protecting civilians from the retaliation from the government side. And this is when the new strategy from the government side started by detaining and like arresting medical personnel. And I'm going to share quickly some slides and photos to give you an idea about these violations. So starting from arresting and detaining healthcare personnel, and PHR did this research in 2019, documenting and creating this link between the ill treatment in detention and in prisons and the provision of healthcare. So personally speaking, as a former detainee who was purely arrested for my work as a medical personnel, the only questions that I was asked was around my work as a healthcare provider and who I'm working with. Later, when some of the areas went out of the government control, medical facilities start to be established in the governmental controlled areas, and this is when the government switched its strategy toward attacking healthcare. And as you mentioned, with the last attack that took place on Saturday, the number of the attacks against healthcare facilities hit the 600 against 350 separate healthcare facility. And this strategy also was aiming to deplete the human resources from within the country by also killing healthcare personnel and healthcare providers. So as you can see in this photo, more than now, with the most recent attack, more than 930 health personnel were killed inside Syria. 91% of these killings are attributed to the Syrian government and its allies. Also, part of the international human the IHL violations, we witnessed the use of the inherently indiscriminate and dumb weapons. So as you can see in this slide, the Syrian Network for Human Rights documenting the use of around 82,000 barrel bomb, which are inherently, as I mentioned, indiscriminate weapons against civilians. And of course, my direct work and the documentation that I worked on is around the use of chemical weapons. And as you can see in this slide from a study published by the Global Public Policy Institute, more than 330 chemical attacks were documented inside Syria. So unfortunately, none of these violations are put to end, but as Syrians, we continue to witness these violations happening, and as you mentioned, even by the last weekend.
Thank you, Hossam, for this really sobering introduction and your background. I just want to honor your own experience, how remarkable it is that having suffered the way you did personally and with so many colleagues, that you've continued in advancing your skills, your medical profession, your public health learning, and continue to do this really critical documentation and advocacy. So thank you for being with us and for sharing the ongoing documentation of these IHL violations. And we'll get back to you for some more detail shortly. You mentioned, Hossam, this strategy of the Syrian government to literally attack health. And it's in that context that I'm going to introduce our extraordinary next speaker, Dr. Amani Baloor, who many of you may have seen in the film The Cave, which is a remarkable, astonishing film of the hospital that SAMS and others created literally underground in a cave to avoid this strategy. And I won't say that much more about the film because I believe Dr. Baloor, who is a pediatrician and an advocate for women's and children's rights, and who managed this cave hospital, which was the subject of this Oscar-nominated film, will share with us her story. But just to note also that Dr. Baloor has received many awards, including from the Council of Europe, the Raoul Wallenberg Prize, the Refugees International Exceptional Service Advocacy Prize, and just a few months ago, Dr. Baloor gave extremely powerful testimony about the attacks on health at the UN Security Council, also advocating for the essential cross-border aid. So Dr. Baloor, Amani, welcome. Thank you for joining us from the UK now. Is that where you are today? Where are you today?
From Germany. Thank you.
In Germany. Thank you for joining us from Germany. Over to you to tell us, I think, a little bit about that experience working under the conditions of constant bombing and attack, and how you and your colleagues managed to deliver care in spite of that.
Yeah, thank you for having me. Good evening, everyone. It was like, I will start with what UN described the Eastern Ghouta when we were there. They said that it's hell on earth. It was like hell. It was death everywhere, and because the constant targeting for the hospitals and medical centers, we moved to work underground, and we spent about 6 years working underground in inhumane circumstances and lack of medicines and medical supplies. We were always target for the war plans. Russia and Assad regime were always targeting us. They bombed my hospital many times. I can't count these times. I can't remember, but I remember once when they targeted my hospital in 2015, and they killed 3 of my colleagues and my friends, and they targeted it again and again without accountability. So that was very difficult circumstances there. We were, for example, the cancer patients, they have nothing. They stay without the treatments, and we were just watching them, waiting for them. We were always called the UN, the international community, everyone out to help us and to do something for us. But the cancer patients died one by one, and about 9 of them died without helping from anyone. And that happened for many patients, for many casualties, for many children I've treated there. So that was some examples of the situation there, and that continue to happen now without accountability. No one care about that. People all the world are just watching us now. I can tell thousands of stories happened in the Eastern Ghouta, and the same people who are there now, they moved to the northwest Syria, and the same children who are suffering there now they are now teenagers, and they are suffering now in northwest Syria at the same circumstances. They're suffering from fear under bombing, which didn't stop and will not stop if the international community didn't do a effective steps, effective actions to stop it and to stop the attacks on medical facilities, to protect civilians, to continue helping people, the cross-border humanitarian aids.
Dr. Amani, can you tell us just a little bit more about the cave?
Yes, sure. The cave started in 2012 because the Assad regime targeted all the medical hospitals and the medical centers in the area. So we just found a basement and start working in. It was just 2 rooms, and I was just with Dr. Salim, my colleague. He is the surgeon, and he started working. He opened the place and started working. Then I came, and with some volunteers, we start to do everything. We make emergency room and operation room and start working there. We got support then after that from SAMS and then from MSF. And we start to expand the place because the casualties were, the massacres were increased day by day. During 6 years, it was it became like a big hospital underground. We make the tunnels to connect the hospital with other medical centers. And we connect it to the grave where we buried people, and this is like it was difficult to bury people in that place. I remember one night in 2018, we slept in the hospital, all the medical staff, we slept with 70 dead bodies. We slept together in the hospital. We couldn't move them. We couldn't do anything but the heavy bombing on the ground, and no one can move on surface. We try to move also in the tunnels. It was not easy, and all the staff were very tired, so we slept with the dead bodies. This is the circumstances. We always were with lack of medicine, lack of medical supplies. We have no all the medical devices, no treatment for the children with chronic disease. Sometimes we don't have the diagnostic devices, the diagnostic tools to know. I remember many children were coming to my clinic in the hospital, and I don't know what they're suffering from. We don't have everything, not all materials. Our laboratory had limited services. And always we call the international community to help us, to bring food and to bring medicine for the innocent people, for the civilians. But their response was very, I can say it's shameful for them to send just every 2, or I remember the UN sent twice or 3 times during 4 years. I remember that they sent humanitarian aids and they sent medicine and some food for the people, which is not enough for all the people. I remember when they said food for the malnourished children, they sent some food and some biscuit and butter, and it was very difficult to give this, to choose the children. All the children are hungry, they are starving, they have malnutrition, and you have to, as a doctor, you have to choose the children who will give the food and to prevent this food from other children. Sometimes we have some sisters and brother in one family, and we choose one child who is the worst situation and give food, and don't give his or her sisters or brothers. That was very painful for us as doctors, as medical workers there. And sometimes we choose between the casualties, like what happened in the chemical attack in 2013, which was the worst situation I've been through. I chose the people, all the people were suffering from the same symptoms. They are all of them were suffocating, and I chose children and let others to die. The people who we didn't choose, they died because we didn't help them. So I still feel guilty because of that.
These choices are absolutely unacceptable, obviously, and it must be so painful for you to tell these stories. But thank you for sharing them, because the resilience that you and your colleagues have shown, and the incredible resourcefulness in this completely really unbelievable and outrageous environment is really quite remarkable and extraordinary. You mentioned, Dr. Balor, that these attacks will not stop until there is effective action. And I'm going to turn to our third speaker, Professor Leonard Rubenstein, Len, longtime colleague and friend, to maybe put this violence, these violations into context, both historical and also a legal framework, as an expert in international law, and especially as somebody who has documented and worked to try to create advocacy for responses to these widespread attacks on health and conflict. Len is a professor of the practice at Johns Hopkins Bloomberg School of Health and director of the program on human rights, health, and conflict there, and is also a core faculty member at the Hopkins Center for Humanitarian Health and the Johns Hopkins Berman Institute of Bioethics. And also importantly and relevant for today, Len is the founder and the chair of the Safeguarding Health in Conflict Coalition that my organization, PHR, is also a member of, as well as SANS, actually, and is the author of Perilous Medicine, The Struggle to Protect Healthcare from the Violence of War, which will be published this coming September by Columbia University Press. So Len, I want to turn to you to put what you've just heard from our colleagues in context, and some ideas about what you have done so far, or we all have done, to try to create an effective response to date, which we don't necessarily see happening.
Thank you, Susanna, and it's such an honor to be with colleagues from Syria in this webinar. And I just want to share that Hussam was a student at Johns Hopkins, and like another of our students here, Mohammed Darwish, the two of them were arrested by the regime for their medical activities. So it is sobering, as Susanna said. I'd like to put the attacks in some historical context. It was 1864 that the first Geneva Convention was adopted, 150 years ago, which outlawed violence against healthcare. But ever since, the attacks have been committed year after year, war after year, war. Just a few years after it was adopted in the Franco-Prussian War, hospitals and ambulances were attacked. In the war in Ethiopia in the 1930s, it was the first time that air power was used to deliberately target hospitals, and efforts at accountability there through the UN went nowhere. Then, of course, we had the issue of indiscriminate bombing of cities in the Second World War in Germany and Japan that killed hundreds of thousands of people. And then in the Korean War, which people don't really know about, the relentless and indiscriminate firebombing of 18 cities likely killed, no one knows the number for sure, 1 million people, and destroyed an estimated 1,000 hospitals. And this was after the adoption of the modern Geneva Conventions in 1949, but those did not include a restriction on indiscriminate attacks, which then, of course, continued in Vietnam. In 1977, there were new protocols to the Geneva Convention, which finally outlawed indiscriminate attacks. But even after their adoption, they continued, and targeted attacks continued. In the 1980s, South Africa supported militia and insurgent groups targeted healthcare in Mozambique as a way of destroying the government's effort to provide healthcare to the population. They destroyed 200 health posts and health centers and looted 300 others, murdered health workers. And then in El Salvador, health workers were arrested and murdered. So this shows that violence against healthcare is not new. But there are ways in which Syria is quite unique because it involves the most intense and longest period of targeted violence against healthcare and strategic bombing of hospitals ever recorded to my knowledge. It is that strategic relentlessness that marks its uniqueness. It is strategic in that the attacks are connected to military offensives. So that is why in the last year or two, it's been the Idlib area, which has not been the focus of the attacks, although not the exclusive ones. The intensity also has included hospitals that might otherwise be safe, including those in caves, as Dr. Amani talked about. So Syria represents a grim entry into the book of war crimes. It's not also another aspect of Syria which is unique, is that no one can say we didn't know. The most remarkable documentation has taken place in Syria, including by Physicians for Human Rights and chemical weapons organizations. Because of their work and many others, we know how many attacks there are. We know in real time, in many cases, technology, interactive maps, real-time videos and data, hundreds of thousands of photos have shown what is happening right from the start. The documentation has been comprehensive and reliable, and yet we see that a decade into this war, it has been allowed to continue. I'll stop there and we'll get into that question in the next round.
Thank you, Len. Again, more sobering information, even on the framing front and the historical front. And as you mentioned, Physicians for Human Rights also in our documentation have noted that there has never been, to our knowledge, such intentional, systematic, and widespread deliberate attacks on health facilities and personnel in any conflict, although we do see, as you note, attacks on health in far too many locations around the world. And I will call people's attention to the Safeguarding Health in Conflict Coalition annual report that came out earlier this year, as well as one which also covers the 5 years since very important UN Security Council Resolution 2286, which maybe Len you'll refer to in their next round. But I want to follow up particularly on the use of chemical weapons, which also has profound impact both on the health and well-being of the population, but also creates a form of terror in society. And Hossam, you have been really critical in documenting as a doctor, right on the front lines and witnessing the impact of these attacks. So maybe you can just describe a little bit what your experiences have been regarding chemical weapons.
So as a physician who worked in a conflict zone in Syria, maybe my work around the chemical threats is one of the most challenging files that I worked on, starting from the fact that use of chemical weapons inside Syria was considered a red line for Obama administration, and then the involvement of many UN Security Council resolution around this the disarmament of the Syrian government from the chemical weapons. All these factors played a huge role in crafting how organizations and individuals and healthcare providers were responding to the chemical threats. I remember when I was in Aleppo working in the hospital and like getting some reports from Damascus countryside, mainly around the use of chemical agents, like in a very limited scale. That was before August 2013. The preparedness and response to chemical threats in Aleppo was active, not sufficient. No one showed interest, not because they did not want to work, but because there were many other challenges facing the health system, including the continuous deliberate targeting of healthcare facilities and civilian infrastructure in the city. But then when the attack took place in Ghouta in 2013, that was mind-blowing, because we did not know how we can respond. And the number of casualties and deaths are even beyond the capacity of governments to respond to. Luckily, after that attack, the UN Security Council Resolution number 2118 was adopted, and the destruction of the chemical weapons in Syria started. Unfortunately, on practice, 300 out of 336 documented chemical attack in Syria took place after this resolution. And OPCW during that period of time did not have a clear strategy for investigating these attacks. In 2014, chlorine started to be used, and I was involved in a documentation process where I went from inside Turkey to Syria, collected evidences, testimonies, biological samples, and went out to Syria to deliver these evidences to the OPCW, but they rejected because they did not, as I mentioned, they did not have the strategy to investigate and collect these evidences. Luckily, then the fact-finding mission was established on August 2014, and they investigated the attacks I worked on documenting. And this is when they confirmed the use of chlorine against civilians in Idlib countryside and Hama countryside. And then the joint investigation mechanism, UN OPCW JIM, was established. And this is when it was clear that the Syrian government was the one behind the use of chemical weapons. So it's really challenging, again, from a medical perspective, responding and preparing to such attacks that were initially targeting civilians as sort of punishment. So when I went and investigated the attack on Tel Minnis, it was a village that hosted the IDPs from the front lines in Hama, and it was a punishment for the civilians for hosting these IDPs. And that continued as a pattern even until 2018. And Dr. Amani can talk about this when the regime also used chemical agents against civilians in Douma as part of the military escalation that took place.
Hussam, can you just very briefly describe as a physician what the injuries were like, or what happens with a chemical attack to the human body from what you saw directly, very briefly?
Yeah, so it depends on the agent that is used. So when I went to Kafr Zita and Tel Minnis to document, it was clear the bleach odor on the environment. I could smell it because I reached to the Tel Minnis location 24 hours after the impact, and I examined some patients in Bab al Hawa hospital, and I saw this like immersed damage that the agent caused to the respiratory system of these victims, and how they were like getting worse by time because of the high dose of exposure they had.
Really disturbing. Just to clarify for people who don't know the acronyms, the OPCW is the Organization for the Prohibition of Chemical Weapons that did the investigation into Syria at the international level. Moving to Dr. Amani, can you sort of bring us up to date a little bit on, I mean, you have this experience with the Cave Hospital and the chronic conditions that you also treated and have been so concerned about. How are health workers and health systems today continuing to cope with these sorts of violations, especially in the context of the recent round of attacks, so shockingly, blatantly in front of world view, after rounds and rounds, as Len said, of documentation and condemnation, et cetera?
Yeah, unfortunately, the health workers now in North Syria, they have to deal with the same circumstances that we did for 6 years before. And this is actually very shame that after all these years, the same situation is now. The medical facilities are few compared to the large population Northwest, about 4 million people, depends on few hospitals, I can say, and it's not with all tools and supplies which people need. So they have to work, they have to continue working in spite of all these circumstances. For example, after they targeting the Shifa hospital, they always they just try to fix what the Assad regime and Russia destroyed and continue working, because people need these services and there's no other alternative for the people. People need to get it's something that you can't delay or you can't stop. So we did the same before, and people trying to do that. But I think the most important thing to talk about is the constant threats to stop the cross-border aids, to stop the medicine and medical supplies for about 4 million people now. We were trying to ask for more cross-border corridors, for more humanitarian aids. Now everything is the situation is getting worse. Now the financial support from the countries after the pandemic is less than what was before. Everything is less. Now we have only this humanitarian corridor, Bab el Hawa, and now Russia tried to use its power all the time to close this humanitarian corridor and prevent all these people, children, innocent people, to get the services, food and the medical services. So it's very shame on international community to make Syrian people to reach to this point. We just now want this humanitarian corridor to these people. This is everything. The Syrian revolution started with asking for freedom and democratic country, and now we want only to help these people to get their essentials, to get food and safe drinking water and good medical work. They are living in inhumane circumstances. The medical workers are suffering to get the needs to help people, and many times they couldn't find what they need. Many times they told people that we don't have this medicine, we don't have this service, and there's no way to do. I know many people died because they couldn't get the medical services there, and they couldn't enter Turkey. It's not easy for everyone to enter Turkey to get treatment. So it's now very bad circumstances, and I actually I was always hopeful, but now I'm not. And I hope that medical workers there can continue working and continue providing the medical services for the people there. And I hope we can do everything we could to support them and get the needs for them.
Thank you. It's such a very important message, and I believe this was the main message that you delivered to the UN Security Council. Just to remind our viewers that in 2014, there were 4 cross-border openings from neighboring countries into Syria to allow international humanitarian agencies